So now that when you were in pharma, was it difficult? I mean, from yeah, I understand there was a challenge from clinical to non-clinical, but then from your previous role in a medical device company and now you're in pharmaceutical, what was the challenge like?
The challenge was, I mean, I'm in AstraZeneca. So the challenge was actually how fast MNCs are. So it's a very fast-paced organization as well. There are a lot of different processes. There are a lot of different working in a bigger team. So in my first company, it was a very small team of 5 of us. And now you've got, your huge sales team, huge marketing team, different cross-functional teams. So that was like a culture shock the moment I came in my first 1 month. It was honestly a big culture shock, where I had to gather as much in the first 1 month and just get the ball rolling and start running because in MNC, you know how things are. It's just day in, day out, day in, day out. So that was my big struggle, adapting from a smaller base company to a big MNC.
Okay, so did you ever, at that moment, did you started doubting leaving clinical practice, or you were like, okay, no, this is it, and there's no turning back?
I think I'm the kind of person, Selena, where I adapt very well. I think my friends can say about this. So one of my key strengths is adaptability. So I told myself that now, like I never gave up in interviewing. I interviewed 4 times to enter pharmaceutical. So I persevered very hard. So I told myself, all right, I'm in. Um, you just gotta do it, Sean. There's no other way. You just gotta learn, adapt, and do. And I just put my head down and just
What do you think were the key skills that you had from your clinical practice that you brought on with you into pharmaceutical?
I think the biggest asset that a doctor can bring to pharmaceutical is your strong scientific acumen. So obviously, when you enter pharmaceutical in medical affairs, science is our basis. Obviously, there's different therapy areas as well. So my biggest strength that I brought in was my strong scientific knowledge. That's one thing. And another thing which I felt that the strengths I had as well from clinical work is sort of working under pressure. Because as doctors, especially in anesthesia, you're used to resus, you're used to the stressful environments. So how well you handle stresses is another important thing that I brought in as well. So I think my two biggest things is the knowledge aspect of being a doctor and the stuff around medicine, and obviously handling stresses.
Okay, so now that you're in the pharmaceutical industry, how do you feel that is different from clinical practice, and how are you impacting healthcare differently?
I would say it's a completely different approach. So as a clinician, you're treating, you're the frontline person in treating patients, using your skills to the best advantage possible. Whereas in pharmaceutical, we are making an impact on the overall of healthcare with our different drugs and molecules. And not only that, like what I feel that I've learned along the way in my 2 years in AZ is how you how you work together in different means, from the government perspective, from working with doctors to changing policies and changing the whole paradigm or ecosystem as a healthcare perspective. As a company, that is what I felt that you're giving back to patients in a bigger way. So even though I'm not treating patients as a clinician now, I'm still helping patients in a bigger perspective with our drugs, with our molecules, and with the changes we're doing.
Join disruptive doctors. Oh, disruptive doctors.